Awesome. So excited to be here. I'm Duane Wiafe, social worker in private practice. And I'm very excited to be meeting with Norma Nicholson. As Norma, we've met before in some training, and I've worked in a correctional environment prior to going into private practice for years, 15 years. And I'm really excited to connect with you. Our intro, Norma Nicholson is a nurse, educator, public speaker, and a youth advocate. She is the author of Young Lives on the Line. You Can Make a Difference, which was published in 2014. I know there are some other publications which I'd love to hear about. You're also the founder of Ignite for Youth, which is a not for profit organization which focuses on the education around the root causes of challenging behavior and problems observed in at risk, underserviced youth. I'd really like to hear a bit more about some of the other work you've done, other publications you've put together.
Oh, thank you for having me, Duane. Yes, my first book was Young Lives on the Line, You Can Make a Difference, which continues to be used as an educational vehicle for families and mostly Black and minority young people, because my advocacy is focused on youth or youth of today that sometimes become so marginalized by society due to a mental illness, mostly undiagnosed. But since I've written that book, and I'm positive I've touched more than 1,000 lives with it, I have published my what I called Walking Miles, My Vocation, which talked about my 46 years as nursing, five of which was spent in the largest youth custody facility in Ontario. And then I retired, and my husband and I adopted a pet from South Korea. And all the children on our street kept asking, when will you write a book about Cody? So I've written three books about Cody, and they're varying age group. And I tell you, it's opened up a new world where I focus on literacy with Black children and minority. I also focus using that simple children's book on how librarians can manage and work and build relationship with our Black youth that they have been telling me they come in to smash up their library and smash up their books. But I have used that book to bring them around to thinking where literacy is really important in the lives of our children. And then my most recent book is called End Incarceration of Black and Minority Youth. And that book was actually written out of the trauma I suffered for the 5 years I worked in youth custody and see the daily inhuman and traumatic approaches that were used against Black teenagers.
That is a lot. That's amazing. I'd love to connect with you a bit more about that book. I think it's great that you're accessing many areas of Black mental health. I am a health professional, a social worker. I've worked within a correctional environment, and I think that book is very has the potential to be very powerful in terms of Black staff members, whether they're health professionals or not. People don't recognize the trauma that one might go through being a part of some of these oppressive systems, even if we are trying to make a difference, watching, seeing these sorts of things. So I think that's great that you've been able to capture how you've coped and how you've moved on. Can you share a little bit about your personal journey to get to where you are now? Like, you know, post education, was it, what did you know it was always going to be corrections, or how did you get here?
No, not at all. I actually worked as a nurse with children at the hospital for sick children for 18 years as an educator. And then when a new hospital was built here in Ontario called the Credit Valley, I was asked along with two of my nursing colleagues to come over to start up a pediatric and an outpatient unit. I then worked at an outpatient hospital. I moved from there, and one of the things I noticed in the outpatient was that Caucasians received more effective and timely care than Black patients. And those were Black men and women that came in for healthcare post cardiac arrest or post stroke. And so once I started working with the team, it's amazing how they looked at individuals that require unique care and not because they present as black or white. So one day I was just sitting in my office going through Indeed, and I saw this job popped up, and it says, "We are looking for a director of our healthcare services, and you must have the skills to start from base." And I think I have those skills by working at a hospital before, but I know nothing about corrections or juvenile except the way Black kids are treated in the community. They must be treated worse when they're incarcerated. And that's how I applied for the position, and that was more than 15 years ago, Duane. And I can remember when I went for the interview, there was no Black person around the table. So they were learning from me. And as I got up to leave and I shook the hand of the CEO, I said to him, "You will not find a better candidate because most of the incarcerated young people are Black and Indigenous." And he says, "Thank you. You will hear from me." That was 12 o'clock. I got called to have the job at 4 p.m.
Hmm. That's
And my focus has been since that day to be a small cog in that wheel that makes a difference.
well, it sounds like you were more than a small cog. And I think, the funny thing about a correctional environment that I've noticed, like now that I've moved into other work, is sometimes the environment and the pressures, the policy, and the stressors when you're within the environment have you feeling as though you you only have skill in this area with these particular people. And similarly, when people are coming in from the outside, often that thought, well, I've never worked with juveniles or people in custody. And I think that's one of the most important things, like that criteria in screening of bringing people in, which what will put you at high on the list is correctional experience, is the exact criteria that reinforces the problematic thinking.
Yes.
Because if I worked in one correctional environment, I'm bringing those ways of knowing into practice. And I think having someone who's almost like a blank slate, because that's the tagline in corrections, right? Whenever I would bump up against a barrier, it was no, 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 we don't do things like that. That's not how we do business, right? And I think you coming in with fresh ideas, and it sounds like that was being in a position to make some decisions where you have a team who are wanting information, who want to learn, is what probably helped with having such a huge impact at your time there.
Yes.
Um, can you can you tell me a few barriers specifically um, for Black youth in terms of accessing or participating in mental health care that you saw when you were working in that facility?
What surprised me the most was that, and they just have all kind of anecdotes. They really don't collect any data. And but what surprised me the most, because I work so very closely with those young people, and I hired a mental health nurse before the place was even opened. and I hired a renowned psychiatrist. In fact, I was just at a workshop one day that he was delivering, and he was coughing away. And I said, "Would you like some water?" And he took the glass, then he came down and sat beside me and he drank the water and he says, "How is it you were the only one that asked me if I needed a drink of water?" And I say, "There is a reward waiting for you. I have been reading about your skills and you've been working in the courts. I would like you to consider coming to work with me with these 150 young people that we will be housing in custody at this new facility." And he says, "Oh, you can work in a jail. What do you do in a jail?" And I said, "I'd like to have coffee with you and we'll talk about it." And so when I talk to even trying to hire a medical physician, he's the only one that is still there. The psychologist, everyone has left, and I can share why. But when I looked at the physician, he said to me, "I've only heard kids are so bad. I don't want to come into jail to get knocked over." And I say, "You will be surprised when their voices can be heard, when they see that they are a part of resolving what is happening with them, then you will be able to help them because you will see the difference." So, one of the things that the barriers I came across is when young people are admitted into custody, they're not there because they have been found guilty. Like 75% are there waiting to be tried. They could come in overnight. The other 25% are serving anywhere from 10 days to 2 years of custody for crimes of which they have been found guilty. But one of the barriers was getting individuals working with these young people not to treat them as if they were convicted criminals. The other thing I found is because we as Black folks, and I say that very respectfully because there are many Black folks that are so brilliant, but they don't spend time to see the behaviors of their kids and trying to find out what happens. So, would you believe that a majority, and I think it says 47, I can see 41% of young people that are admitted to youth custody have an undiagnosed mental illness.
Hmm.
So, what I support the staff in doing is everyone that is admitted and documented is placed on the list to see a psychiatrist and the mental health nurse or a psychologist. So everyone who passed through, and there are some young people, because not only the mental illness they've been covering with addictions and other things in the community, they have no family support because Blacks, because of the way we've been treated in the past, sometimes think that their children are not telling the truth, that they are lazy, that they don't build relationship with them, that they have not suffered trauma. And when they are incarcerated, that is usually the only time that someone listens and say, "We need to delve into this and see how we can work together to get you well."
Hmm.
That's the main barrier. And it takes a very long time for even youth service workers and nurses to say, "This youth, the baseline and root cause of the behavior, it's because of the undiagnosed mental illness."
And I think that that we talk about stigma, mental health. There's stigma in mental health across you know all humans, but especially in Black communities, right? We don't talk about mental health. We want to. There's kind of these expectations at how we manage. Like I do a lot of my work now with men, and I've done some groups with Black men who, you know, just having a space where you can feel comfortable acknowledging that I've been depressed or any of these things. And that translates into our homes, right? If I'm a father of
Mhm.
4 children. If I don't have conversations about my health around my son, where does he learn that this is a part of overall balance and managing mental wellness? Um, what are some things that you would say are helpful to address the stigma piece, specifically when we look at, Black youth and trying to get them engaged in mental health services?
I think we actually have to start from they're much younger. And there's a lot of immigrants that come to Canada, including myself, though I've been a Canadian for the past 56 years. But one of the things that I found is believe what your children say. You truly have to take the time to listen to them. Do not draw any conclusion before you hear them out. So the example may be a youth who came from the Caribbean, did not come to Canada till he was 15 years of age. He's now living with a mom that does not know him very well. He's also living with his dad because there are very unique families. And what happens is they say to that young man, you go to school, you get in at this time, you do this, you do this, you do what is meant in my house. They have not even acknowledged, maybe because they're lacking the skills, maybe because they're working so often, kids are left on their own. They have not acknowledged what that young man has missed in his past life. So even to talk about how are you managing not seeing your grandmother, not writing your grandmother, not seeing your friends? What are some of the things you would have done back home when you came home from school, as opposed to saying you must come home, you must do your homework, etc.? Tell me more about it. And I think I would say to parents of teenagers, zip your mouth and open your ears. It's amazing what you can learn from your children if you just ride your bicycle with them, go for a walk in the park, sit on a bench, have an ice cream cone with them. I learn more right now, Duane, from 4 and 5 year olds that I didn't know before. So, can you imagine the information that our teens bring with them? And if you think back about your teenage years, oh, it is one of the most vibrant, creative, happy time. And if you have such a teen that is not socializing, not participating, something is wrong. It may not have led yet to a blown mental illness, but their well being is not being attended to. So when you go to the doctor, some teenagers say, "Don't come in with me, mom." But you may want to say to the doctor, could you also look at his mental health, his physical health, his emotional health, as opposed to the broken toe he came in with? So there's so many things we can do to prevent our children even being out there on the street. I am working with a mother right now, single mom, who's she told her son, you get home from school at 4:30. He did. Then he was allowed to go up to a party, and she says, you get home here at 9:30. He was home at 10. And she said, you pack your things and get out of here if you don't want to listen to me. At 10 o'clock, when he got home, he had no voice. So I often say to parents, when you are making a plan with your children, as simple as what time they should get home, hear from your teen. Get a balance to say, okay, 10 o'clock we're agreeing on, quarter after 10 no later, especially if they have to take the bus. And you're saying, don't get in with such a company. But they may be talking to their peers when they can't talk to their parents. Did you know that at the teenage years is the time when we have most conflict with our parents? Because they don't listen. Yeah, so there are just a few things. I could talk the whole day about this because I'm trying to get parents to value their kids, love them. Do not repeat the negative things you hear because they are oppressed by the justice system. They are oppressed by the school system. They are oppressed by the child welfare system, and one just system just joins into each other. And because there are so much stigma about mental illness, they don't really focus on it at all. Don't share it with anyone. Don't tell anyone. But any problem that is not addressed, as you know, only worsens, doesn't get any better.
Yeah. I, I think it's like what I'm hearing from you is kind of the importance of changing the culture around how we manage our families. And you're right.
Yes.
Like, Black is not just, we're not a monolith, but there are some similarities in Black homes versus other
Yes.
homes. And I can relate to that idea around yeah, I only saw a doctor if I was sick or for a checkup or whatever the case may be. There was not a lot of discussion about, mental and emotional help. And when there was, it often got kind of streamlined out towards, spirituality or prayer or something like that,
Mhm.
which there's value in it. And it's important to kind of include other things, right? And I find that is kind of the tricky piece. Like, as someone who, my parents came here, I grew up here, obviously as a mental health professional, I have these conversations with my four children around health. And
Mhm.
when I made a career change, I talked to them about burnout and thinking, maybe I needed to do something else so that I could be physically okay and manage, right?
Mhm.
I think the thing I wanted to just put out there is, I also think the unique thing about Black individuals is the importance of elders and
Yeah.
respect for elders, and how, as a 40-year-old man, if my father were to walk in the room and ask me to stop doing something, I would listen to him, regardless of what degree, what experience, and what I do.
Mhm.
So because that's such an important part of how we will make change, what are some other ways that we can engage these elders? Because it needs to come from there, right? In terms of, getting us to kind of start looking at our health overall globally and actually taking control of our health. Um, are there any initiatives or anything that you've been involved in, like, to kind of encourage parents to even to educate themselves? Because a lot of us, especially like immigrants or people who maybe have not worked in the field, it's new to be talking about. We often think depression, you're lazy, right? Get up and go get a job. So
Yeah.
how do we bridge that gap with that population?
It makes me reflect on 2023 Black History Month, where I spent 2 hours at the library. The families had invited me to come and speak to behaviors in their children and how they have no manners. And I had them share examples with me. In fact, we had little sticky notes and they wrote the examples and put them on the board because I didn't want anyone to feel ashamed. But there were things like, as you say, there was no one at the top in some of these families, no grandmother, no grandfather, no elder uncle or aunt to say, come on, what is it we're doing? Let's talk about this. And what I found, glad you said lazy, because one parent shared that when John doesn't want to get up out of bed to go to school, I think he's so darn lazy, though he tells me he doesn't feel well. He doesn't feel well to me means he's lazy, and there's not another individual to say, okay, let's John tell us what else is happening. Because he could be depressed, he could be bullied at school. So, what we have to try and do is get families together. Yeah, we don't have grandparents, and it's so good. There are lots of families with grandparents here, but there doesn't seem to be many black folks with grandparents. So either they've passed or they did not want to come to Canada. But we need to have more than our insular family. So this insular family of a wife, a husband, and their two children, we need to engage other members of our family, either a bit older than us, just to toss ideas and to
Mhm.
get involved with our family. Because if it's just our lone voices, and there are also very good youth groups. I've been involved with youth groups. In fact, last Sunday at my church, I had a mini book launch, and there were 32 youths that gathered around. Of course, you provide pizza and stuff, and they'll come. And three or four says, Norma, I wish you would talk to my mom and dad. They don't listen to me. These are Caucasians and blacks. They
Yeah.
don't listen to me. When I say I'm not feeling well, they still say drag out to bed. And what I do is I don't go to school. I don't learn. And then they get upset if I have no grades. And so there were tips given, and I saw some of the seniors listening, like their parents. Ask mom, could we just talk? And not say, let's talk right now, or let's go out to the dinner table, or go up. The demands don't work. Plan something and engage more, just than your insular family, because we don't have an African village. We have to build it.
Mm. That's so important. I think that building, and even in this day and age, there's so much opportunity to connect in different ways. Like, years back when you started and were, lobbying for like the first health professional, I could see why there would be more barriers. But even post pandemic,
Mhm.
there are so many ways to connect. There are so many ways for people to gain access to their culture. Um, I wanted to ask what if you can speak on the role of allies in this battle, right? Because I know whenever we talk, even just this post, I shared it on my social media feed, and all the comments. Well, why are we're going back to the '80s? Why do we have to talk about black? Why can't we talk about people were kind of all lives mattering this post? But I wanted to know for the non-black health professionals who go out of their way to learn, who want to have an impact, because I know with some of my peers when I was in my grad school and we were talking, there's kind of this, as they become more knowledgeable, there's also this uncertainty, like, is there a role for me to help? Like, am I overstepping? Am I contributing to this? And I think that we need to figure out ways to support and encourage allies whose voice in some situations could provide that added support that we need in order to move forward. Any thoughts or experiences about your work and what non-black health professionals or youth services officers, like, what their role is and how we can encourage them to be a part of this discussion?
Oh, there are many youth service officers, Caucasians, that would like to become allies, but they get retribution.
Yeah.
So you've got to read my book.
Yeah, yeah, yeah.
They get retribution while they're at work when they reach out to help Black youth that are mentally ill and truly don't understand. But out in the community, maybe because I have a part in my church and there are not many Black people in my church at all. And because they know that my focus is helping young people, and they will listen and they will actually attend the sessions,
Hmm.
and I will get the occasional feedback that says, "Thank you, Norma. When I saw that young man last week, I really try not to categorize him by saying, oh, he must be terrible because he's wearing his pants below his waist, or he's wearing a toque and he looks horrible." I used to think that way, but now I think I wonder what is happening in his life. Because I also have the opportunity, having been the chair of our Peel Police Services Board, to give concrete examples to recruiting officers. And I would say a 16-year-old is walking north on a street and it is now 10:30 in the morning. Classes are in. He should be at school. Why do you think he's walking on the street? And what I will hear the officers, Black and white, they will say he's either looking for where to break in later, he's just lazy and don't want to go to school, um, he's just no good.
Mm,
And then I say, a human being, turn the negativity around. Could he not have money to pay on the bus to come to school and he's walking? Could
mhm,
he not have a grandmother at home that has dementia and he had to make sure the place was secure before he left? Could he not have a mental illness that he's just wandering around? And if you're driving your cruiser, you needed to have stopped and say, "May I help you? What is happening?"
mm,
So I have a few, but I haven't come across many Caucasian who are able to verbalize that in fact they see a tall Black young man walking and they cross the street.
mhm,
Yeah, and that's one of the things that bothers me the most, is that even in the school atmosphere, you find that the young people don't get together with their different cultures. Blacks get together, whites get together, Eastern kids get together. And that's a real challenge, because if you don't learn from each other, how are we going to change?
I I had a conversation, a couple of conversations in a few federal men's institutions over the last week. Actually, I just did like a talk, a mental health talk with federally sentenced men today before this, and over my time, I had some communication with with the Roy McMurtry Center, and I know that there's a large Black population, very like a lot that jail is primarily Black boys, and you know I wanted to ask you, with all of your experience and insight, if you could have complete control over that institution. So you can make a change, but you can only make one to start. So this, you, obviously, we're picking the most effective area that you think could start to move that correctional environment into the best direction to promote engagement and mental wellness for their population, which is primarily Black. Where would you start? Would like what would be the first thing that you can see right there as like, okay, if we could at least get this part right, it's a good and lasting start.
I have about 10 things, but I'll start with
Give me a
one.
few. You know what? Give me more than one.
Um, No disrespect to correctional officers who have had seniority and work in adult facility. The approaches are very different.
Yep.
And though there is rehab for adults, even addressing rehab for a 12-year-old, a 13-year-old is very different. So, number one, in that facility right now, there are correction officers that have replaced youth service officers because some of the adult facilities have closed. So, prior to their transfer there, they needed to unlearn with assistant and paid training, unlearn some of the approaches they were using with adults and learn what is effective approach with a youth. For example, an adolescent that is awoken at 1 a.m. and say, I'm making rounds now and it's your turn to go to the bathroom. And the 14-year-old says, Sir, why are you waking me up? I don't need to go to the bathroom. I have nothing wrong. And the officer says, Well, it's your turn. And you come to the door. And a youth service officer would have said, Okay, you don't want to come, go back to your bed. Sorry, I woke you up. You be up on time for school. The correction officer says, I told you it's time to go. You come to the door.
Right.
The youth walks to the door and he refuses to come out. And he further says, I am not a baby. I don't need to be awakened to go to the bathroom.
Right.
So excess force is called, and that young man is dragged all along the concrete walkway, and he ends up in isolation, secure isolation, for several days until he learns how to behave. So that's one of the things I would like to see, changes in the approach that is used with our young people. The second thing is to get back a youth advocate. They only have an ombudsman now. And I joined the round table a month ago talking to some. There are 36 young people in this small custody facility. 18 of them are Black kids. And one said, I would love to talk to the ombudsman. Nobody tells me how to do that. And he said, I was playing around with another kid, sprained my wrist. I went with a note to the coordinator because that's the way we get a nurse to come and see us. And the coordinator looked at me, tore the note in pieces, threw it in the garbage, and said, If you want to stop fooling around, you would need your hand looked at. So, from top to bottom,
Mm.
from the highest level to the people at in line with the youth every day, I would like to see some sensitivity and relationship, not even DEI, sensitivity and relationship, and valuing the core beliefs of a young person.
Mm.
They can't move forward. Many of them, when they leave there, they don't need a bus ticket to go to the shelter. Once discharge is being planned, they needed to have some support to find a place to move to, especially if they can't go back to where they lived before.
Mm.
Those are two main things. The other thing I would like to see is the kids go to school every day, Monday to Friday. Sometimes they have no teachers, so they just laze around, watch TV. So their educational level goes down. And then when they get out of there, their literacy cannot be compared with the kids who have been allowed to go to school. Yeah, though, as for mental health, part of building relationship is to learn about how mental health affects me and how it can affect others. If you don't know about yourself, you can't provide help for others. And when you don't know, get the mental health nurse or get the psychiatric nurse or make a referral because they still have those individuals working there. But the psychologist just left because he was receiving no referrals.
Huh.
Go figure.
Wow. That's unreal. it
Yeah.
it yeah, I love that that example rings true for me. I worked in a women's facility for probably for my the majority of my career when I was working in prisons versus in parole offices. And the closure of Kingston Penitentiary, that what you're talking about
Mhm.
occurred. Men and women's corrections is very different in terms of the skills needed and the efforts put in to address issues on with females incarcerated versus men. And with that closure of the institution, you had that disbursement of people based on seniority, right? So if I'm
Mhm.
living in Kingston, maybe I really have family in Toronto, I'll go to Kitchener, and it's a different mentality where maybe there's more situations of physical force in a men's institution, and more alternate efforts considered in a women's. But then when these people, there is training, but I think it needs to be more around, like you're saying, relationship and understanding the values unique to those people.
Yes.
I always, that always rings true to me when I think of corrections. One of the federal corrections, one of the parts of the mission statement says, human relationships are the cornerstone of our endeavor. And that's always something. Every time I have an issue or I'm dealing with something, I always focus on that rapport building, that relationship piece. And I think when that relationship is strong, you can even have more of an impact on some of those challenging sort of
Oh, yes.
conversations. But, you know, I really like that as somewhere that we can start. Do you find that you mentioned this earlier, and I mean, you just talked about the lack of referrals for a psychologist, but, you know, staff retention, right? Getting staff, specifically mental health staff, to want to work in a correctional environment, right? And I think you talked about, it being hard to keep people, which I think is part of the challenge, right? So you don't have consistency for various reasons. What would you say is probably one of the any of the main reasons why people don't stay, people in health, or why staff wise, why they move on to other things?
Well, they're highly trained, first of all, because when you're a registered nurse, in order to become a psychiatric nurse, you need to go and obtain a few certificates and update your skills. So if I'm in an institution where my skill set is not even being used and I'm not listened to at all, then why would I want to stay there? It's not a workplace for me. I could have continued working today at that institution if there were individuals who valued even two or three things that were my values.
Hmm.
I would have stayed working till I could not go to work anymore. Yeah, they don't listen to individuals, and they meaning the people who are closest working with the young people. So things that you'll say, he is really tired today. He started a new medication. Could you allow him just to sit quietly for the next hour after you have taken everybody? Well, why should we do that? We're not going to be treating him
Yeah.
special. So there's not any listening to each other. I will go over to the secure isolation area and I will say, good morning to the officers. May I see John that is in room 10? And the officers say, well, what do you want him for? He did XYZ overnight and he won't listen to us. And I say, I just need to say hi to John. Would you kindly open the door? Open the door, and John is so relieved to see someone who respects him and
Mhm.
talk to him and value him as a human being. And I will say, I'm so sorry this is happening, but the doctor is here today. I'm going to see if they will allow you to see the doctor. I should have been able, as the head of healthcare, to say, I will talk to them, you will see the doctor. But no, they know it all.
Right.
And at the suffering of those young people, yet they expect them to come back and join society, and their delinquent behaviors are worse.
Hmm.
Their delinquent behaviors. You hear them saying, well, why would a kid need methadone in here? Where did he get his addiction from? I'm not going with you to go get any methadone. And then I have to explain over and over, if he does not get the methadone, what is going to happen to his psyche and his health. Well, this kid has sickle cell disease and he needs to be having daily drink of water. Well, if he had such a disease, why did he go out and get into trouble and is locked away? Let him suffer. And when he suffers, he sickles and he has to spend a month in hospital. Yeah, I sometimes feel like I could carve out someone's brain and deposit some common sense and caring and passion into the lives of these individuals who says they're actually caring for others.
Yeah. I think it's, being aware of time. I will say just the use of language, the labeling, that's an inmate, that's an offender. I think we don't realize how powerful that is, and that
Yes.
when we forget that that is a young boy or a young girl or a man or a woman, it kind of justifies this inhumane way of looking at them. So if someone's
Mhm.
ill, someone's ill. If someone needs help, they need help. But we kind of use these things, and I recognize that the hierarchy of different professionals, you know, safety always goes to the top. And under the
Yes.
guise of safety, we sometimes limit access to mental health, not realizing that the importance of health and compassion and caring, like the actual impact that might have on someone
Mhm.
actually rehabilitating. It's almost
Yes.
like we're fighting in different directions. Um, do you anything else that you'd really like to share? I'm really interested in that book about sort of managing and navigating a system, like navigating as a nurse. I think that'd be really important for health professionals. What was that one called?
Oh, the last book I wrote?
Hmm.
He, uppercase. I'll send it in an email to
Awesome.
you.
Yeah, and we'll share
And
it.
because you're in Canada, do get it from Amazon.ca.
Okay.
.com, you're paying a lot for, for the exchange. Our dollars are not worth much these days. But because society, we really have to get together, Duane, as a group, whether black, white, blue, or brown, and realize that there's such a thing as being mentally unwell. And there are some individuals who have high levels of mental illness and they don't even know. It's just hyperactivity for them. They also need to know that for teenagers of any culture, mental illness tends to heighten and roll itself out in the teenage years because of the different changes in the brain. So if they were traumatized as children and now they're being traumatized as youth, that really sends them right in the depth of mental illness. And all of us teachers, everyone need to know those basics. Yeah.
Yeah. I hear you. Yeah, I think there are some really promising things going forward in terms of some efforts that we're doing I know in the federal system, in terms of understanding, the impact of social history and intergenerational trauma. So I'm hopeful. I really appreciate you making the time and coming, and I'm really excited to see what we can do, like what the future of new young nurses and social workers and correctional officers will kind of bring to this space. So I wanted to really thank you and say I appreciate all of the work you've done. I hope that by the time I'm at where you are in your career, that I've had even some of your accomplishments and impact. It's really inspiring to meet you.
I am humbled by that. Thank you.
No problem.
Bye.